Well, thank you everybody for joining us again today. My name is Stephanie Dahl and I'm one of the owners at Dahl Fisher. And today we have incredible guests with us that are going to talk about functional medicine and their company and how that plays into everything that's going around with COVID-19. Also here today is my partner, Kelly Fisher.
Hi, I'm Kelly Fisher. I'm Stephanie Dahl's partner and very happy to have Trivida Functional Medicine with us today.
Awesome. Meghann and Corey, you want to introduce yourselves?
Yeah, I am Meghann Feldman.
And I'm Corey Feldman.
We own Trivida Functional Medicine. We are a married couple that owns a functional medicine practice here in Centennial and soon to be coming to the Highlands in Denver as soon as all this stuff can open back up.
Right, absolutely. Well, I'm going to start with a really basic question for those people that don't know. What is functional medicine and how is that different from, I think, the medicine that everybody kind of, I'm going to say mainstream, but I think it's what everybody is used to.
Yeah, absolutely. Yeah. So Western medicine is, a typical term for what, everybody else is used to. So functional medicine really focuses at getting to the why. So we all have symptoms and those symptoms sometimes bring us to the doctor. Sometimes we just let them ride. But those symptoms really have a reason. There is an underlying cause or what we call a root cause. So what we really focus on is figuring out the why. Why did the symptom happen? What's going wrong in the body? How can we fix it? How can we fix the current symptom? How can we fix the pain and the problem? But also how can we fix it at the root cause so it doesn't continuously come back up again? And this comes into play a lot with chronic inflammation, autoimmune conditions, thyroid conditions, gut issues. All of those things have a root problem. So if we can figure out what that is, we really have an opportunity to fix it and educate our clients on how they can maintain it for the rest of their lives.
Mm-hmm. Yeah.
So in the context of right now, the COVID-19 crisis and kind of the different things that people are dealing with, I guess my first question is, a lot of the conversation we've heard is that for people who have kind of underlying conditions, they're more susceptible and more at risk. So in terms of what you all do, what kind of things do you help your clients with to try and get perhaps some of those health conditions under control to put them in a better place to be healthy moving forward?
So major things we focus on here. So I always tell people we focus on 5 things. Number 1 is nutrition, because the food we eat truly is the life-giving energy that allows our immune system to function. So if you aren't eating the right foods, if you aren't giving your body the right foods to have the vitamins and nutrients for your immune system to function, then your immunity is going to be poor. Number 2 is physical activity. There's been actually several studies coming out lately showing that exercise does help with COVID-19. And we've known this for years, that exercise does help with immunity. But specifically COVID-19, exercising has been shown to decrease the effects of COVID-19 in people who have had it. Number 3 is hormone health. Your hormones are the communicators of your body for your immune system and otherwise. And if they're not communicating effectively, you're going to feel as if your body is breaking down or feel like your body is off kilter. So we really need to make sure those are in alignment. Number 4 is stress. And when I say stress, a lot of people think of, finances, kids, traffic.
The current stress we're under
right now.
With COVID-19.
And that's absolutely true. It is, that is very stressful, but they forget that also not sleeping well at night is stressful, that joint pain is stressful, that viruses are stressful. So I want to make sure that my patients and the people that I work with, their stress load is low, so that God forbid they do get a virus or something bad does happen, that their stress cup doesn't overflow and cause a tremendous issue. And then the final piece I work with, number 5, is detoxification. I don't mean anything fancy with detoxification. I'm not talking about pills, potions, lotions, or sticking a hose up your rear end or anything like that. What I'm talking about is getting rid of your stresses. So if a joint hurts, stopping that pain. If you can't sleep at night, helping you sleep. Whatever your stress is, we need to get rid of that. So again, if you do get sick, if you do get hurt, your cup doesn't overflow. So that's how we're really working with people in this time right now to keep them healthy and make sure that if they do get sick, they'll have a better chance of getting out of it.
Really, ultimately, immunity or stress leads to inflammation, and inflammation leads to immune disorder. So, you know, when you have chronic inflammation and inflammation throughout your body, that's really when your immune system starts to break down, because your immune system is fighting that inflammation, and then it doesn't have enough energy to fight the virus. So that's why people who are immune compromised are under more risk, because they have more inflammation in their body, and their body doesn't have enough good guys to go fight off the bad guys, really. Basic terms.
Basic terms.
That makes a lot of sense to me now that you put it that way. I got it. Tell me about, so what can people do to decrease, obviously, it sounds like that inflammation piece, and reduce that stress so that they can give themselves the best chance possible?
So I'll go ahead and start this one, and then she can, she'll put in more layman's terms if I overdo it. That's why we work together so well as a pair. Really, to fight off inflammation, you gotta know why you're inflamed. So something I say to my patients all the time is test, don't guess. So the ideal way, and this is ideal in a perfect world, you would get blood testing or gut testing or some type of testing to figure out what it is that's causing your inflammation. Is it blood sugar? Is it lack of nutrients? Is it hormone imbalance? Is it a gut bacteria? You know, is it a joint pain? Whatever it is, we got to figure out why you have inflammation so that we can get rid of it. If you're just looking for generalized inflammation reduction, some of the big things that help pretty much generally everyone, and again, I always hesitate to talk in generalities. I know in law, I'm sure it's the same way.
We hate the same. We hate it too. We're like, wait, every lawyer answers start with, well, it depends.
Depends, right? It depends. That's exactly what they teach us in medical school. It depends. You know, but if you're talking generalities, gluten, dairy, soy, corn, sugars, high sugars, getting rid of those in your diet if you can. I'm not telling you can never drink a beer again, or, you know, never have some ice cream or anything like that, but decreasing the loads of those things in your diet, making sure your nutrients are good, vitamin C, zinc, vitamin D, you know, getting out and seeing some sunlight every once in a while. You know, those are really helpful for the immune system. Exercise, sleep, and then de-stressing as much as you can.
Well,
yeah, he just took all the fun things out of life in that like one little statement. No drinks, no sugar, no bread, and no cheese.
Corey, you took away every love of my life. This is not good. No, I was just going to jump in and ask a quick question, because I know that, and I've done this with you guys, which is an incredibly insightful panel, but you all do this blood panel, and it's far more extensive than you would ever get at your normal physician's office. Will you just talk a little bit about that?
Yeah, I mean, so when I tell, you know, people, when I talk to people, most people have had blood work done in the past at their primary care physician or something like that. And most of the time, again, I was a primary care provider. I know this. Most of the time, it's about 2 to 3 pages of blood work. My blood work's about 14 pages long. And the reason that is because if you truly want to get to the bottom of whatever's going on in your life or your body, you need to look at everything. And believe it or not, the 14 pages is not everything, but it is a broad brushstroke of what's going on in your body to really give us an idea of if we do need to look deeper at something, we know exactly where to go and what other tests we need to do to figure that out.
And I think one of the helpful things with the testing as well is digging a little bit deeper into things will tell us risk factors. So in some of the testing we do, we're able to estimate or understand overall risks. So somebody may go to their doctor and say they get a cholesterol test, and their cholesterol test comes back normal and everything's fine and they're good to go. Now, when we get our cholesterol back with the extensive panel that we do, we can see if there's any future risk that they need to be prepared for, so that they can kind of be proactive and make small lifestyle changes or be aware of some of the lifestyle changes they need to make before it becomes an issue, right? And that's ultimately what we want people to understand, is that we can see this, you know, sometimes 5-10 years before it actually becomes a symptom. Now, a lot of our clients come to us with symptoms. They're in pain, they're sick, they need help right now, but there is ways to look deeper to make sure that, and also estimate, like, if we don't fix this now, it's going to get worse. So now is the time to really fix it and get things better before it gets worse.
Right. And just to really quick mirror what Meghann just said, is most stuff that regular doctors, and I am a specialist, right? We are specialists here. We're not your average doctor.
Corey's a physician assistant.
But
I don't think we said that.
we do have a doctor on staff too, but we are not your average medical providers. We are specialists in the case of, I want to find stuff before it breaks. Not, the doctors out there, the hospitals out there are great at fixing things once stuff is broken, and God bless them. Don't come to me with a gunshot wound, or if you get stabbed or fall off a roof or something like that.
Arm.
Don't come to me with that. But if you want to make sure that, bad things like heart attacks, strokes, horrible things like that don't happen, we can see that stuff coming 5-10 years before it happens, just only because we look deeper, and especially with the initial blood work.
So it sounds like, Corey, from what you're saying, and you too, Meghann, that your approach is intended to be very proactive, right? To try and catch stuff early on, to prevent problems in the future. And you've talked a lot about nutrition and good habits as far as exercise and sleep. Right now, with people kind of being sheltered in place and maybe not having the normal access to grocery stores and gyms and things that we're kind of used to, if you had to give people maybe 2-3 pointers that to do at home that's manageable and doesn't kind of add stress to the pile, what would those things be?
Number one, I would say stretching. So keeping mobile, stretching on a daily basis. We are sitting, we are lounging, we are watching a lot of Netflix. You might be teaching your kids, who knows? You've got a whole lot of new jobs. So I would say stretching is really big, because it's going to keep your body mobile, and that is going to keep inflammation. It's not adding too much stress to your body. If you're already stressed because you're out of work or dealing with financial crisis right now, it's going to just help build your body back up. So I said, number one, stretching. You can do it inside. Kids want to do it. It's fun to do with everybody. So that would be one really big thing. I think focusing on healthy whole foods, right? Yes, it's harder to get food, the grocery store, it's not quite as accessible. Although I have to say we're in a really great time technology-wise. You can get groceries delivered now. There are, and with the exception of maybe meat, the vegetable section is a plethora of deliciousness. It's, very vibrant right now and everything. So definitely, eating whole, healthy foods is going to be really critical to just keeping that inflammation down. And then I would say just gratitude practice is something else that I think would be really helpful on a daily basis. Just saying what you are thankful for, because it's hard. It's really hard right now, and it is really stressful. And really, what I've heard from a lot of psychologists is that people are going through a grief phase. It is just like death, and it's a huge grief phase, whether they've lost jobs or their whole lives have changed. So just really that gratitude practice, I think, is really, really helpful. So if I could do those 3 things, that would be the top 3 things I would say. The one other thing I would say is getting some good vitamins and minerals, zinc, vitamin D. One of the challenges is our supplement companies are all overrun and backordered. So go outside and get your vitamin D in the sun when you can, when it's not snowing here in Colorado. But go in your backyard, go out on your patio, get 10 minutes of sun, and it's going to make a world of difference in your overall mood.
Yeah, absolutely.
Awesome. Thank you. So obviously you all are still open right now. Are you all taking on new clients? How are you working with clients? What does that look like?
Yes, absolutely. We're taking on new clients. And something I if we could find maybe a silver lining to all this, I mean, there's some silver linings out there, but I hope that this whole situation inspires people to take care of their health maybe a little bit more seriously than they have in the past. Like we talked about before, people with underlying conditions were more susceptible to COVID-19. And, I hope now that again, it's not a matter of if this is going to happen again, it's a matter of when. And if we all can be proactive and all take care of ourselves, then when it does happen again, we could be better apt to take care of ourselves, more appropriately and not overwhelm the hospital systems,
the healthcare system.
Yeah. So that's what we're here to do, and that's what I hope people will want from us moving forward.
Yeah, and we're still taking on clients. We're fortunate in the way that we can switch to a virtual practice and do telehealth with our clients. So all of our clients have switched to video, HIPAA compliant video, chatting, so we can still see them, they can see us. They're still on their journey, and it's been beautiful to see kind of what comes out of this as they get started. And everybody has just maybe a little bit more time to focus because they are home, so they can focus on their health a little bit more. But yes, we're still definitely seeing clients. For new clients coming in, we're doing virtual consultations with them. We are still able to get blood work done, all of that sort of thing to get things going. So.
And I understand that you all have been part of the community, the local community here for quite some time. I think, Corey, you and I might have been in high school together in the same place at the same time, even if we didn't know each other at the time.
It was a big high school, so yeah.
It was a big high school. That's
Kelly was in the smart part of the high school.
Kelly was in the smart kids class. No.
I don't know, Corey, you've done pretty well for yourself, so. I understand that you all have kind of a neat testing going on for COVID-19 antibodies that is kind of a give back for you all to the community in terms of offering that to people as an opportunity.
Mm-hmm.
Yeah,
so a little bit?
Yeah, so we are doing COVID-19 antibody testing. What the antibody testing will do is it will tell a client or a patient if they had COVID-19 in the past or if they came into contact with COVID-19. So what some of the questions is how many people came into contact and were asymptomatic or had very minor symptoms and didn't have the really bad symptoms that we're hearing in the news. So this will help us understand, get some more data. I think that's one of the biggest things that the medical community recognizes is the need in order to figure out how to do better next time and how to anticipate this a little bit better is to have more data. So this will give us that data, but it's perfect for those who maybe thought that they were sick in January or February and feel as though their symptoms really matched up with COVID-19 and it was before any of the testing became available. It will tell them if they had it. It'll tell somebody if they came in contact with it and did not have any symptoms, that sort of thing. If you've had it more recently, if you were diagnosed with it, it will let us know that your body is producing the antibodies that you need to fight it off. So within the virus process, it goes through a change in antibodies. So you first see your IgMs, and that's your first line of defense, so to speak. And then it turns into IgGs, and those are sort of your long-term fighters, the ones that are going to fight over time. And then it can move into IgA, which is even longer term. And so the testing that we're doing is testing all three antibodies, IgM, IgG, and IgA. And it's also testing 4 antigens. So antigens is where the virus came into your body.
They're the bad guys, yeah.
Yeah. So whether you got it in your throat, in your chest, whether you came into contact with it by touching it, it'll tell us kind of how it came into your body, how you got it. And then it will tell us that process of where you're at in producing the antibodies. So it is really useful. It's one of the more advanced testings that is available right now. And we are doing it in our practice. So we'll put some links below if you're interested in getting that test. We are testing, let's see, next Friday, and we're doing basically 1 day a week. There's a lot of people that want this testing, and it is a labor of love as far as scheduling and organizing and everything like that. So we're just doing 1 day a week right now for testing, but we are offering that. Yeah.
And just really quick, just to, for example, if you get chicken pox and you get chicken pox once, you should never get it again because you've built up an immunity to it. So same thing true with COVID-19. If you do have antibodies to COVID-19,
the theory is, and with every other virus in the world, this is true. So I don't imagine it'll be any different with COVID-19. But if you have antibodies, you are immune to it now, and that's the premise of vaccinations, right? You put a virus or a virus-like structure into your body, and it builds the antibodies to it. So as long as COVID-19 is like every other virus that we've ever come in contact with in the entire history of our existence, the same thing will be true. If you do have the antibodies, you are now immune. And that will allow people to get back into society and, allow people to open their doors again. And, what I'm hearing, and actually I've been in, some people from high schools have contacted me, teachers and support staff from high schools have contacted me. High schools are wanting their entire staff to be tested to see if they have antibodies so that they can start opening schools back up again. So
That's
for
what,
summer
yeah,
programs
for summer
and things
programs.
like that.
So this will hopefully be the impetus that'll allow us to start living our normal lives again.
That's wonderful. And just for everybody, and I know Kelly kind of mentioned this too, but this is truly your give back. You all are not, you're just, the cost of the test is really the lab fees. This has, you all make zero money on this. This is truly what you want to give back because you know how important it is and you care about the community. So thank you, because I know that testing is a big concern from everybody. Well, perfect. Is there anything that we missed that you feel like everybody should know about or think, or, you know, anything like that?
I would just say, with regards to what's going on, keeping a calm demeanor about it. I think there's a lot of stress and fear of the unknown, but just staying as calm as you can, as long as you're protecting yourself and being responsible and social distancing and protecting yourself when you do go out into public. We're all going to be okay, and we're gonna get through this, and life will return back to normal. So I would just say, take a big deep breath and know that it's going to be okay, and this is not going to be the forever for us.
Right.
Absolutely.
And you know what I would say, I would echo that for sure. And again, focus on your health. You know, do what you can do for yourself. Focus on your nutrition, your fitness, your hormones, your stress, and your detoxification. You know, and if you don't know how to do those 5 things, find someone who can help you with these things. And that's what we do here, so that, you know, you can live your best life no matter what's going on.
One thing that I've said that's been on my heart kind of since all of this started is that those people who are fighting chronic conditions, chronic thyroid troubles, you know, chronic inflammation, gut issues, those issues didn't go away because coronavirus happened. And, you know, our medical system is really taxed right now. They're very focused on the front line and what they need to do to fight this virus, which is what we need them to do. But we're able to be here for everybody else. And for those of you that are still fighting something on a daily basis that just causes you pain and frustration that is not related to coronavirus, you know, we can come in and help, and we can make huge differences in your life. So we would love the opportunity to do that for you guys.
Awesome. Thank you guys so much both for being here. And I know that, you know, I have run into some of your clients, current and past, and they have nothing but incredible things to say about you guys and the work that you do. So thank you so much. And to everybody, we will put Trivida's information so you may contact them, reach out to them if you want to start a program with them or get them to be on your side to start taking care of some of these things so you're in better health. Please do not hesitate to contact them. But Meghann and Corey, thank you guys so much for being here with Kelly and I today.
Yes, thank you.
Yes,
Thank
awesome.
you.
All right.
Bye.
Bye.